Just repeat what you just said to me.
I said I'm as fit now as I've ever been. I've got as much energy when I finish the day as I had when I started. I'm climbing up on builder, I climb up and down on scaffolds all day, and I'm really hacked off at the end of the day because there's so much more to do, and I just up and down. I've got the owner's watching me about 3 feet away, but I also know that people are paying for the money, they are paying for the job, and I want to give them, you know, good value for money. But I've never felt so good at the end of the day. It's hard. You know, before I used to come home and I'd bloody near die, crawling to bed. Now, you know, at the end of the day, I still got energy. I go to the gym twice a week on the way home. Yeah. So
great. And your swelling and your ankles gone down. Some
ankles have gone down.
Look at that. Yeah. Looking pretty much the same. That one was really swollen before. And what do you think's done all this?
Well, it's the nutrition, the fasting, and the super antioxidants and the supplements. The whole lot are working together. Yeah. I'm sure it's that, because it just works. And, you know, 75, God almighty, and people say, "What the hell are you working for? Do you love work?" All day. It keeps me out of bed in the morning. It's something to get up for.
And what about your platelets? Do you want to say something about that?
Yes, look, my platelets, I just can't believe it. I was on drugs 4 months ago that was costing $12,000 a month for these drugs, 3 little pills, which were costing $120 each. Oh, yeah. And I'd gone through the grind with Pharmac because they wouldn't give me those until I tried everything else, including taking vincristine chemo, which they didn't tell me the side effects, but it gives you numb feet. And it didn't work, but you had to do it if you could get on the strong drug. And now I've got bloody damaged nerves on the bottom of the feet. Another drug they called me with gave me, which dexamethasone. They didn't tell me the side effects of that either until I ended up in a wheelchair. It just destroys your muscles, and I knew I was getting weak, but I thought the drug's got to work because, you know, but it didn't, and I had to climb out of that. And so they gave, and I asked them when I went on this thrombocytopenic, this expensive drug, which costs $12,000 a month. I asked them what's the side effects, and they said, well, 10% of the people get fibrosis of the bone marrow, which is a sort of net or whatever that forms over your bone marrow won't allow the platelets to come out. So I said, oh, well, that's 90% chance I won't get it, and that was 3 years ago, and I was only half the dose in, but they had to slowly increase the dose until I was on maximum. And then every 3 months or so they have to give a booster of prednisone to get the platelets to come up, and then they slowly go down. And then I'd have to go, and it was killing me. I had so much prednisone over the years that you can't sleep. You
had your spleen out as well?
Yeah, that's the other thing. Before they'd put you on the thrombocytopenic, you had your spleen out. They actually took my gallbladder out as well, and I ended up with pancreatitis. I got inflammation of the blood vessel that went to your spleen. They chopped the spleen out, and that also feeds the top of your pancreas. Well, that died, so I ended up with pancreatitis in hospital for 13 weeks with a bloody tube up the nose for 2.5 months, all this crap. And then they gave me a bone marrow test, bone marrow biopsy about 3 months ago, and says I got fibrosis of the bone marrow, and there's nothing else they could do. So I got to go back on prednisone. It's going to kill me, you know, and it started to. So I come to see Tyrone and David first, and then Tyrone and Elaine, and you sort it out with nutrition. But the main thing is you mentioned about this fast, and I did a 3-day fast, and without any other medication, my platelets shot up from 65 to 135, and then they started to go down about 10 a week, you know, and they got down to 85. So I thought I'd try another fast. And the bloody thing shot up again, and it cost nothing. Whereas this woman drugs that cost $12,000 a month, and they weren't even working. And you go to the hospital, says there's nothing else we can do for you. So it's virtually, that's it.
Thanks for that.
Yeah.
Great, thank you.